and my topic today is innovative design for implant bone augmentation, precise, controllable, and predictable. Alveolar ridge reconstruction and implant restoration in the aesthetic area is rather complex. Patients with horizontal and vertical defects are very common in our clinical treatment. For the severe defects, there are several techniques for the alveolar ridge reconstruction, including onlay bone graft, splitting technique, destruction osteogenesis, and the most commonly applied GBR. However, most of the techniques are quite invasive and complicated, which require long-term and staged treatment, and the final results are often unpredictable. During the past years, we have been working on the fundamental and clinical researches for tissue engineering, which are related to vascularization and bone regeneration. Titanium mesh has strong spatial support and formability. It can be used for medium and severe alveolar ridge defects. Meanwhile, it can be helpful to achieve simultaneous implant placement. In the past decades, a few studies reported the GBR using titanium mesh to achieve simultaneous implant placement. We designed the L or U-shaped titanium mesh to achieve alveolar ridge augmentation. After the implant placement, the titanium mesh was then formed to L or U shape before the GBR surgery and then stabilized with screws or sutures.